Good afternoon and many thanks for joining us again today. I'm going to start as usual with today's statistics, but I will round off in a few minutes' time with a brief reference to some good news that you might all be seeing in the media this morning. Good news about vaccine development. One of the vaccines that has been in trials across the world has been shown to perhaps be more than 90% effective, so that is positive news. There's a long way to go, of course, but I think this is news that should give us all some tentative hope today. And let's be honest, all of us could do with that, but it should also give us some motivation to keep up with our own efforts in the meantime to make sure we keep the virus in check. But I'll return to that point at the end of my remarks. Firstly, as I say, I will report on today's statistics. The total number of cases that were reported yesterday was 912. That represents 9.1% of the total number of tests, and the number of confirmed cases in Scotland now is a total of 64,355. 363 of the new cases were in Greater Glasgow and Clyde, 219 in Lanarkshire, 107 in Lothian and 73 in Ayrshire and Arran. The remaining cases were across the 7 other mainland health board areas. I can also confirm that 1,226 people are currently in hospital. That's a decrease of 19 from yesterday, and 105 people are in intensive care. That's 6 fewer than yesterday. And finally, I regret to say that 1 additional death has been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. I would, of course, remind you that registration offices tend to be closed at weekends, so the figures we report for deaths on Sundays and Mondays can be artificially low as a result of that. Indeed, in total, since last Friday's media update, 43 deaths have been registered, which takes the total number of deaths under this daily measurement to 3,040. That figure reminds us again of the heartbreak that has been caused by this virus and the heartbreak that is still being caused to too many families across the country. And again today, my condolences go to everyone who has lost a loved one. I'm joined today by the Health Secretary and by the Chief Medical Officer. I've got a few points I want to cover briefly before the Cabinet Secretary will then say a few words. Firstly, let me give a quick update on some developments over the past few days on travel between Scotland and Denmark. As I mentioned on Friday, a new variant of COVID has been discovered in Denmark. It seems to have originated in the mink population and then transferred to humans. In order to reduce the possibility of this new strain coming into the UK, the Scottish Government and the UK Government have significantly tightened travel restrictions. There is now a travel ban on visitors from Denmark into any part of the UK, including Scotland. UK citizens, residents and EU citizens with settled status will be allowed to re-enter the UK, but they and their household must, without exception, self-isolate for 14 days. Other visitors to the UK who have been in Denmark in the previous 14 days will unfortunately not be permitted entry to the UK for now. In addition to that measure, we also strongly recommend that anyone who has arrived in Scotland from Denmark in the past fortnight should self-isolate completely until 14 days after your arrival. So if you arrived in Scotland 7 days ago, you should isolate for the next 7 days. By doing that, you will be helping us to reduce the risk of this new COVID strain coming into the country. As I say, the new strain seems to have jumped from mink to humans in mink farms in Denmark. For that reason, let me just stress that there are no mink farms anywhere in Scotland or indeed anywhere in the UK. A licence is needed to own a mink in Scotland, and we are currently reviewing all licences. If any further action is needed, we will of course announce that in due course. The steps that I've set out today, of course, are not taken lightly. We don't lightly or for no reason restrict people coming into the country. But by taking these steps, we have adopted a precautionary approach in the face of a potentially serious development. And in doing so, we hope we will have reduced any risks which might be attached to this new strain of the virus. The second issue I want to highlight relates to the continuing remobilisation and resilience of our National Health Service. The Health Secretary will say something in a few minutes about a pilot project we are establishing to improve services for people who have had strokes. But I want to highlight an initiative which is relevant to the health service's longer term skills and training needs. We've confirmed today that we will create up to 64 new specialist training posts in the NHS. These cover areas such as public health, the study of viruses and intensive care medicine. Now, this announcement will not have an immediate impact on NHS services in the here and now, but it will help to improve our future capacity in these very significant branches of medicine, branches that have been very important in the course of this pandemic. And it is one of the ways in which we're trying to ensure that our workforce planning in the NHS doesn't simply meet the immediate requirements of the pandemic, although that is, of course, hugely important, but that it also addresses the needs of the NHS for the medium and longer term. Now, the final point I want to highlight before rounding off is that, just to give you the advance notice, that I will make a statement to Parliament tomorrow. This is our first review of the levels that are allocated to each local authority in the country. And tomorrow we will confirm which levels of restriction will apply to each local authority area from this Friday onwards. The final decisions that I will set out in Parliament tomorrow will be taken by the Cabinet at its meeting tomorrow morning. Now, I'm not going to preempt these decisions because they haven't finally been taken yet, but in the interests of being open with you about the factors guiding our decisions, let me just take a moment to underline some of the issues that we are currently thinking about and that will inform the decisions we reach. The first is that the measures we have already adopted in Scotland over the past few weeks and that are now encapsulated in the levels of intervention are undoubtedly having and have had in the last couple of weeks an impact, a positive impact. The number of new cases was rising pretty steeply in the first half of October, but that has now pretty much levelled off. We are in a far better position than we would have been without the current restrictions that are in place and, of course, without your compliance with these current restrictions. Any progress we are seeing is down to the enormous sacrifices that everyone has been making. And the slowdown in new cases, I think, should give us confidence that these sacrifices do work. They do make a difference. So I hope in these really difficult times, everyone can draw some encouragement and some motivation from that. These tough restrictions are not in vain. I know sometimes for all of us it seems as if they might be, but what everybody is doing right now is undoubtedly saving lives, and that really matters. But the second consideration is that although there are these positive signs, as I was setting out last week, it's really important that we start to see these translate into a significant and sustained decline in COVID cases. And we cannot be sure that we are yet seeing that. So I think it is, while no decisions have been taken, highly unlikely that we will see any significant easing of restrictions announced tomorrow. As I've said before, while a plateauing of cases is undoubtedly better than a rise in cases, we can't afford cases simply to plateau at their current quite high level. We need them to fall. Otherwise, we will be badly exposed to any further rise in cases as we go deeper into winter. And we know that a further rise is entirely possible. We can see that by looking across Europe and around the world just now. It was reported today that the world has now seen more than 50 million COVID cases. More than a quarter of these have come in this second wave, and several countries are now reporting record case numbers. We also know that with the best will in the world, there will be more pressure on compliance with basic measures over the forthcoming Christmas period. So that is another reason why we need to see cases right now decline. So we're currently balancing all of these considerations. We're weighing up the fact that we have undoubtedly made progress in slowing down the rate of increase against the very real concern that we are not yet seeing a significant or sustained decline in new cases. So as we do that, we will look at a number of things. We look at the number of new cases in each area and also the trend in those cases. Are they rising or falling? But we also look at a range of other indicators too. For example, we have to consider hospital capacity, intensive care capacity, and of course the linkages between different local authority areas. These are difficult judgments, difficult for government to make, and the implications of them are difficult for all of you. So as we consider them, we consult closely with health boards and public health experts, and we also consult with local authorities, and we will then confirm and set out those decisions in Parliament tomorrow. However, as always, together with the decisions that government has to take, there is an essential, vital role for all of us as individuals to play. And the role that we're all playing as individuals, as I say, has been having an impact in these past few weeks. The best chance each local authority has of avoiding tighter restrictions and of then hopefully moving down the levels in the weeks to come is if all of us as individuals stick to the current restrictions. So once again, let me close by reminding you of what these are. If you are living in one of the areas currently at level 3, that's most parts of the Central Belt and also Dundee, don't travel outside your own local authority area except for essential purposes. You can see what we mean by essential purposes on the Scottish Government website, but it includes work that you can't do at home or caring responsibilities. People in other parts of Scotland should not travel into level 3 areas except for the same essential purposes, and we're asking everybody right now not to travel outside of Scotland, again, unless there is an essential need to do so. These travel restrictions are never easy, but they are vital in order to prevent transmission between areas with high infection rates and areas with lower rates. It's only if we can do that that we will be able to maintain the regional and targeted and proportionate approach that we're seeking to take through the levels system. In addition, none of us anywhere in the country right now should be visiting each other's homes, again, except for specific purposes like childcare, or if you're looking after a vulnerable person, or if you're part of an extended household. When we're meeting people from other households outdoors or in places that are open, cafes, for example, the limit is 6 people from a maximum of 2 households, and it is really important that all of us stick to that. We should be avoiding car sharing if possible, working from home wherever possible. Make sure you've downloaded the Protect Scotland app if you can. And finally, remember facts, which are the 5 rules that, if we follow them, really do reduce our chance of getting the virus and of passing it on. So remember to wear your face mask when you're out and about. Remember to avoid any places where there are crowds of people. Remember to clean your hands regularly, and remember to clean any surfaces that you or somebody else may have been touching. Remember to keep 2 metres distance from people in other households, and remember to self-isolate and get tested immediately if you have any of the symptoms of COVID. These rules are how we all work together to get us through these difficult times. They will help us protect ourselves, but they'll also help us protect those we love and help us protect our wider communities. They will definitely help us protect the NHS, and ultimately it's by doing all of these things that we all help to save lives. So although I know it isn't easy and it can seem harder just now as we are in winter and getting towards Christmas, please stick with it. And I want to end with the point I started on. It might not be visible at the moment, or not all that visible, but there is light at the end of this tunnel, and don't forget that. The news we've heard this morning about vaccine development, one of the vaccines being developed by the pharmaceutical company Pfizer, which has been trialled in other countries across the world, the early indications is that it is 90% effective. That is good news, perhaps amongst the best news we've had in recent weeks. It's not going to provide us with a way out of this today or tomorrow or next week, or perhaps not even in this calendar year. But that development, with all of the other work that's going into the development of other vaccines, does give us right now real hope that in the not too distant future, science is going to find us the way out of this terrible time we've been living through. So hold on to that hope today, but also use it as a motivation. What we're living through right now and all the restrictions that are so difficult for all of us will not last forever. But it is really important that we stick with them now so that we get out the other side of this with as few people as possible becoming ill, with as few people as possible losing their lives. And that means all of us sticking with these tough restrictions that we are all fed up with, but that we know have an impact on reducing the impact of this virus. So please stick with it for now, and keep hold of that hope that we have today, that there is an end, and hopefully we will see it in the not too distant future. Thank you very much for listening. I'm going to hand over now to the Health Secretary to say a few words, and then she and I and the Chief Medical Officer will take questions as usual.
Thanks very much, First Minister. There's no doubt that the COVID-19 pandemic has been the biggest challenge our NHS has faced. But alongside responding to that and providing the best possible frontline care for those diagnosed with the virus, our healthcare professionals have also worked to make sure, as far as we can, that we don't lose our focus on the many other patients with complex and serious conditions. One example of that is the care of patients with severe stroke. The number of people dying from stroke in Scotland has fallen by more than a third over the last decade, but we want to secure better results for these patients. Thrombectomy is a highly skilled procedure used to treat people who suffer a severe stroke and helps reduce the risk of long-term disability. It involves the mechanical breakdown and removal of blood clots rather than using simply medicines. We estimate that there are at least 600 patients across Scotland who would benefit from thrombectomy, and notwithstanding the challenges of COVID-19, we've remained determined to secure our commitment to the rollout of a national thrombectomy service by 2023. Today, I'm pleased to announce a significant step forward in that commitment with the launch of a Pathfinder service for the north of Scotland. NHS Tayside will initially deliver thrombectomy procedures in Dundee for Tayside patients, with the service then extended to patients across the north of Scotland. We're working for a fully operational 24/7 service in Tayside for patients in the north by 2023, and by then we intend that the Queen Elizabeth University Hospital campus will provide a hub service for the west of Scotland, while NHS Lothian will provide a service operating from the Little France site. This would have been a significant undertaking for our healthcare professions at any time, but even more so in the current pandemic. And I want to thank the very many people who have been involved in this really important development in our care for stroke patients across Scotland. And let me particularly thank Professor Iris Grunwald, one of the UK's leading stroke thrombectomy interventional neuroradiologists, who has trained the key staff ahead of this launch and has done so much to help us move forward with this really important NHS commitment. Thank you.
Let's go straight to questions now. Gordon Cree from STV.
Thank you, First Minister. I was just having a look at a chart of infection levels over the past week, and from that, it looks like Glasgow is on the cusp of what could be the level 4 rate, and some other areas like Edinburgh, East Lothian and Falkirk may well be on the cusp of what could be level 1 rates, yet these areas are all in level 3. Now, I appreciate that the numbers are not the sole thing that determines that, but it does seem, does it not, inconceivable that they could all stay in the same level. And if I can ask the Health Secretary, on the back of this positive news about one of the vaccines, where is the health service in terms of being ready for supply and distribution come the point that one or more vaccines get given the green light?
I'll hand over to the Health Secretary in a second. The Chief Medical Officer may want to say something about the vaccine development as well. Look, it's not inconceivable when you take a sort of complex as opposed to a simplistic view of this, as you rightly say, Gordon, and to be fair, you pointed this out. The numbers are important, but we've got to take account of other factors as well. We've got to take account of the relationship between different health board areas, travel patterns, the fact that different local authorities will rely on the same hospital and ICU services. So while I would not suggest that looking at the numbers is not important, it's not the whole story, and it's often the these less tangible factors that are more difficult to weigh in properly in coming to balanced decisions. We also have to, we inevitably, and all countries struggle with this, there is a bit of a lag in our data. We're trying to minimise that lag and get it down to as few days as possible. But we have got some signs of some areas that have been seeing a bit of a decline in maybe the past week. There's a bit of a levelling off of that decline in some areas, maybe a slight uptick again. Now that could look different tomorrow or the day after. So it's not just the data on any given day that we have to look at. We've got to look at the trend, and we've got to satisfy ourselves, particularly before any area moves down a level, that a downward trend has been established and that we think it is sustainable. And a key point I made a couple of times last week that is important to remember, moving down a level, it's not, obviously all areas want to do it and it is a sign of progress, but it's not a neutral act. Moving down a level leads to an opening up, and an opening up leads to an increase in transmission. Therefore, we've got to be sure that the levels that an area have got to of infection are low enough to cope with that. I would not, and I just want to be clear about this, I would not anticipate much easing of restrictions when we announce the first review outcome tomorrow. I wouldn't be expecting areas to go down a level. We are obviously looking at whether there is any case for any part of the country to go up a level. We want to avoid that, and you describe some areas as on the cusp, and we've got to make careful judgments around that. Glasgow's a case in point. Glasgow certainly has seen a levelling off of the quite marked increase in cases that we seen a number of weeks ago. But that levelling off is not a decline, and it is a levelling off at still quite a high level. So we have to judge for Glasgow, for Lanarkshire, for other areas, does keeping the current restrictions, and it may well be that this is the case, allow us to continue to move that to a declining position, or do we need to think about something more? So these are not easy judgments to arrive at, but it's important that we take them in a calm and rational way, with a focus on getting levels of infection down as far as we possibly can, particularly given the period we're going into over Christmas, when, as I said earlier on, there will be all sorts of opportunities. With the best will in the world, this virus will have more opportunities to spread over the Christmas period, so we need to try and get it down as far as we can before then. Jeane.
Thanks very much. It's a really important question, and thank you for that. We've been planning for the delivery of a COVID-19 vaccine for some time. A four-nation plan, obviously with each part of the UK looking at specific delivery requirements in its own area, but making sure that as far as we can, we have the same approach across the UK. It will be here in Scotland, it will be a national plan that covers the whole of the country, with delivery localised to ensure that we can take account of the various populations and geographies of the country, but that there is a consistency across the whole country. We'll use a variety of routes for delivery and locations, some of which people will have experienced in the current delivery of the seasonal flu programme, but adding more local delivery, including the possibility of mobile units for some parts of our country where that makes much more sense, and using local knowledge from our health boards to help us do that. The priority of who will get the vaccine in what order, we're waiting on the Joint Committee on Vaccines and Immunisation to take a final decision on that, and we will follow their clinical guidance as we do with the flu vaccine programme. I had a long meeting on Friday with all of the colleagues in Scottish Government involving clinical advisors and others to go through those plans in detail, and we'll continue to finalise those and tie up the loose ends so that as soon as the vaccine is ready and the Joint Committee has given us its important advice, we will be ready to begin that vaccine programme on the basis of the batches of the vaccine that we receive and the timing of those.
Yeah, I mean, isn't this really encouraging news that we've had today through about this vaccine? And I guess it's not wholly unexpected. We've been following very closely the results of each phase as this vaccine has progressed through its trials. And in each phase, we've been encouraged by the type of data that we're seeing from this. So, as I say, it's something which has been a case for optimism for some while. So, with that in mind, we've been preparing readily in the background for when this vaccine may become available to us, working closely with the rest of the UK, particularly the JCVI, an important committee that determines how we deploy that vaccine and how we prioritise people for some time now. We expect, as Cabinet Secretary has already outlined, the final recommendations from that committee in the near future. The other group, of course, that we've been working with, just to mention, is the MHRA, which is the regulatory body which oversees the deployment of new healthcare products like vaccines as well, and making sure that at the point at which it is ready to be deployed, all the necessary arrangements are in the background as well.
Peter McMahon from ITV Border.
Thank you, First Minister. You just said that you do not expect areas to go down a level when you make that announcement tomorrow. I just wondered if you could confirm that that applies to Dumfries and Galloway and the Scottish borders. The Scottish borders in particular, as you know, could, under the figures and the metrics you use, have been in level 1 when you first introduced these levels of statistics. And if you're going to have these figures, why are you ignoring the evidence that you use to make these calculations, or are you not? Is there something more to it? For example, both of them have their own hospitals, for example.
Yeah, there's lots more to it than that, Peter. And no, I'm not ignoring anything. I'm trying to make balanced judgments. If you look at the most recent data on borders, and I think the most recent data is on Dumfries and Galloway, actually, we've seen over the last few days a slight uptick in cases there, which obviously has to be taken into account. Remember that last Monday, when we first applied these levels, it involved a bit of an easing up in most areas, even in level 3 areas, because there was a slight relaxation of hospitality rules. So there is a real need to give ourselves a bit of time to just be sure what impact, if any, that has had. So we look at things in as up-to-date a basis as possible, and we have to take account of the wider considerations. Borders, Dumfries and Galloway, for example, you cannot ignore the geographic positioning. They are effectively sandwiched between areas in the north of England with much higher rates of prevalence and areas north of them in the rest of Scotland with higher rates of prevalence. So, nobody's ignoring anything, but it doesn't help, and it wouldn't be correct to take too narrow a view of this. I can't confirm anything because we haven't taken the decisions yet. I'm trying to give an indication beyond, I suppose, confirming that Dumfries and Galloway and borders are in Scotland. So my general indications that I have articulated today, of course, apply to them. But I can't confirm any decisions because, as I set out, those decisions will be taken by the Cabinet tomorrow and set out to Parliament later on tomorrow. What I'm trying to do, as I've tried to do all along, is take people along as far as possible in the decision-making process and try to deepen the understanding people have of how we are arriving at these decisions, and deepen the understanding of the fact that it is a complex process. It's not a case of feeding some data into a computer and an algorithm spews out a ready-made result. If it was like that, it would be a lot easier for everybody, but it's not. There's some careful judgments have to be made here as we try to ensure not just a plateauing of cases, but that we don't see the kind of uptick that we possibly are seeing in one or two parts of the country, but also that we get cases coming down again. Otherwise, the position we're in will not be as stable as it needs to be going into the depth of the winter period and the Christmas period as well. Andrew Anderson from BBC Scotland.
Yes, thank you, First Minister. Good afternoon. You've said it's unlikely you'll be announcing any significant easing of restrictions tomorrow, but I'm wondering if there are some parts of the country that should be preparing themselves perhaps for a toughening of restrictions. I'm thinking particularly of Fife, where cases are currently at 108 per 100,000. So are they at a risk at the moment from moving from Tier 2, which they're in currently, to the tougher restrictions of Tier 3?
going to go beyond what I've said today for the reasons that I think most people understand. We haven't taken these decisions yet. I'm trying to be clear that I wouldn't expect an easing of restrictions. By definition, of course, we have to look at whether there are parts of the country where infection levels and direction of travel say that the current level of restrictions may not be enough to do all the things I'm talking about. We try to avoid that. We try to avoid and will try to avoid, if we can, parts of the country going up a level. But if there is a situation where, if we don't do that, we may see a further spiralling out of control, it is sensible and cautious to do that. But I'm not, I know I create this difficulty for myself because I try to be open about the state of our decision making, and then everybody wants me to go and jump a step and say what the decisions are. I can't do that. But I think it's still better to try to take people along every step of the way. So Cabinet will take the final decisions tomorrow. I'll be having further discussions this afternoon with Gregor and Jason Leach and others to try to make those judgments. We want, and I want people to be clear, that the sacrifices they are making are having an impact, but this assessment of whether that impact is sufficient to get cases coming down again or whether we're seeing a plateauing is a really important one, because cases across Scotland right now are not as high, anywhere near it probably, as they would have been without everybody complying with all of these restrictions, but they are still too high for comfort. And what I mean by that is if we then saw a bit of an increase as we go into a festive period with people maybe just finding it harder to comply, then if it takes off again at the current high level, it would very quickly overwhelm us. So these are, quite difficult considerations, but ones that we are, I think, broadly getting right, because we're seeing a picture in Scotland that is not anywhere near what we feared it would be by this time, but we've got to try and continue to get them as right as possible in the few weeks that lie ahead. Bernard?
Yeah, I think all I would add to that is, of course, it's right that we take these decisions based on the latest information that's available to us, and we continue to track the data in a number of areas across the country. The National IMT is meeting just now, and I'll get a report from the chair of the National IMT after this briefing, to get a sense of the position that the various directors of public health feel about the progress that they're making in their areas as well. All of that is factored into the consideration. I want to get the point across just now that the data is incredibly important in terms of how we make these judgments, but the data is not everything. One of the really important things to be assessing just now is the trajectory that we see each of these local authority areas on just now, and how quickly that improvement or decline in the number of cases is occurring in those areas, so that we get a real sense as to how things are going to track forward as we get into the deeper winter.
Alan Smith from Borough.
Thank you, First Minister. North Sound has spoken with Scottish Conservative leader Douglas Ross this morning. He's calling on the UK and Scottish governments to work together to allow oil and gas workers to be tested offshore more easily if they're contacted by contact tracers, rather than having to be flown back to the mainland. Is this something that's been discussed between the two governments? Is it something that has been considered? And just on the vaccine, of the orders that's been placed by the UK government for this vaccine, do we know yet what the allocation for Scotland will be? Is it likely just to reflect the population share?
I have the Health Secretary on that. Of course, we don't yet, as far as I'm aware, understand exactly what volumes of this vaccine will be available over what time scale to the UK, and therefore from that to Scotland, but the Health Secretary will say a bit more. On oil and gas, we talk about all sorts of things to the UK government all the time. I'm not sure if that particularly has been looked at, but we look at advancing our testing programme all the time, and will continue to do so in line with very clear clinical priorities, which is what responsible governments have to do, and we are obviously informed in our testing strategy by the advice that comes from our clinical advisors. Jeane?
So the First Minister is right in terms of not yet having final information about the volumes that will come to the UK and over what timescale, but we've had quite a detailed discussion about whatever those volumes are, what would be the proportion coming to Scotland, and we've settled on it being a population share because when we do the calculations based on where we think the numbers are in terms of priority groups, the difference is minimal. And we, of course, we have the relationship with the UK government, that where we might see any situation where there is a need for greater supply or less supply, then we can tweak that, because all the planning for this vaccine and its delivery has been done on that careful for-nation basis.
Thanks, First Minister. Again, on the Pfizer vaccine, some scientists have commented saying, well, of course, this is welcome news. A potential issue might be the temperature at which this vaccine has to be stored at. It has to be stored at a very low temperature, I think around minus 70 degrees or so. Is this an issue which the health service is aware of, and could it pose any issues in terms of how the the vaccine is rolled out?
Storage, refrigeration, these are all aspects that are factored into our planning. The Health Secretary will say a word more about that.
So it is an important issue. All the different vaccines that are currently going through trials have different requirements, if you like, in that regard, different properties about them, including the number of doses an individual might get, the period in between those doses and so on. And that's why the planning group here in Scotland that I had that long discussion with on Friday, I fully expect to have another discussion this week, involves our head of medicines policy and our interim chief pharmaceutical officer, as well as members of the chief medical officer's team, our deputy chief medical officers, our delivery planners and so on, so that we can factor in all those elements. And that includes the logistics of getting the vaccine to where we need it in Scotland, the storage requirements, as well as all the planning that's in place for the workforce and the locations and the accessibility for those who will be vaccinated.
Derek Healy from the Courier.
Thank you, First Minister. School Leaders Scotland is calling for teachers to be allowed to work from home to help cope with staff shortages. Can you say if that's something you would support? And just a bit more generally, we also appear to be seeing a rise in children reporting mental health problems in relation to the pandemic. Do you think the kind of current school strategy is working, or is there anything more that can be done to help support that?
I missed the start of your question, Derek, so I didn't hear who you were quoting. Local authorities have to make decisions. If teachers are vulnerable in the shielded category, then obviously they have to make decisions to support them to work in a safe way. But I don't think we've made any bones about the fact that our objective is to keep schools open as long and as far as we possibly can, because we think that is better for the education and the mental health of young people. And that's why sometimes that will mean adults like us having more restrictions in order to create the headroom around this virus to keep schools open. We're not complacent about safety in school, safety of teachers and older pupils in particular, which is why we've amended some of the guidance around face coverings, for example. But I think it is pretty well accepted that as far as we possibly can, we should create and protect the conditions for young people to be in school as normal, as far as that is possible. Do you want to add?
I think what I would say in addition to that is we know that for children during the first phase, when we saw the rise in cases and many of them were working from home, that the experience of distress and mental illness was a much greater problem, and all the evidence points towards creating as normal as environment for learning for them as possible, but also for the peer support actually aids them and makes sure that they are less likely to suffer those type of problems in the future. The 4 CMOs released a joint consensus statement earlier on this year, and we identified the various advantages that there are for children in maintaining an open school system where they were getting their learning in person, and that included the enormous benefit that the children had in terms of their mental health as well as their educational experience as well.
Tom Martin from the Express.
Hi, thank you, First Minister. You've discussed the likelihood of restrictions being eased tomorrow, but I just wondered if you could give us a bit more thinking about whether you're thinking on whether we're going to need legally enforced travel restrictions, given the importance you've attached in your remarks about moving between different areas.
No, I can't really give you any more on that today. I'll set that out in Parliament. One thing that will not change is that there will be advice to not travel to and from level 3 areas. Whether that continues to be guidance or is statutorily enforced, if there's a change in that, I'll set that out tomorrow. But don't, I would say to people watching, don't spend too much time thinking about the differences there, because fundamentally the travel advice will remain. If you live in a level 3 area, you should not travel outside your own local authority area, and people elsewhere in the country should not travel into level 3 areas. That advice is not going to change. Whether the underpinning of it changes is another matter, but the advice itself will not change. Christine Lavelle from The Sun.
Thank you, First Minister. There are fresh calls today from the Labour MSP Monica Lennon for widespread routine testing of NHS workers to be introduced to protect the health service. Why is this still not happening 8 months into the pandemic? And wouldn't it be a way of preventing hospital-acquired outbreaks and infections?
There's lots of different work goes on to prevent hospital-acquired infection, not just in COVID, incidentally, across all sorts of infections that can transmit within hospitals. The answers to these questions, as I'm pretty sure you know, are set out in our testing strategy, where our clinical advisors have steered us in terms of the prioritisation of the testing capacity we have. So there are groups of NHS staff that are routinely tested already, and that's been the case for some time, and we are extending that. We do that in line with the growth in capacity and in line with expert advice. But the Health Secretary might want to say a word or two more.
Just a couple of things, if I may. As the First Minister said, we already do test NHS staff who are asymptomatic, who aren't showing any symptoms, in oncology, in long-stay care for the elderly and long-stay psychiatric care. We have a number of additional groups of people that we would want to extend routine testing to. That's set out in the clinical and professional review paper that was published 2 or 3 weeks ago as part of the testing strategy, as an addition to the testing strategy. And as we scale up the NHS capacity, which I think we've already covered in these briefings, then we are planning which of those groups we will introduce over what time frame for the rest of this year and into next year. And that, of course, includes additional frontline NHS staff, including our ambulance service.
Mark McLaughlin from The Times.
Good afternoon, First Minister. There's a school of thought out there, I'm sure you've encountered, that because coronavirus mainly affects the elderly, that they are somehow on the way out, 1 foot in the grave already, and we should therefore open up society. So what do you make of that view generally, and how do you think the election of 77-year-old Joe Biden as US president, not reaching the top of his game until that age, affects that view?
If there's a school of thought along the lines that you've just articulated there and how you've articulated it, which I know you're just doing as a journalist, incidentally, I don't think it's a school of thought that has that many subscribers. Ethically, it's not a school of thought I would ever sign up to, that we just write off a section of our population. Practically, it's not feasible. We live in integrated lives. Young people live with older people, work with older people, socialise with older people. We've got older people that we all love in our families. The idea that you can just segregate one part of the population and let everybody else open up and live normally is just practically, as well as ethically, in my view, not a serious and sensible proposition. It's also just a fallacy that this virus poses no threats to younger people. Young people are less likely to die from COVID, but it's not the case that there is zero chance of young people dying. There have been, deaths amongst the younger population, and almost every day right now I hear and read, and you will too. I read a very powerful and moving account by one of your own colleagues, BBC journalist, at the weekend about long COVID. Young woman who 7 months on from having COVID is still effectively not able to function properly because of the long-term effects COVID has done. Anybody who thinks that for anybody or any section of the population the risks of this virus can just be shrugged off is not being sensible. This is a virus everybody, regardless of age, regardless of background or other characteristics, should do everything in their power to avoid getting. Yes, that's particularly true for older people or people with other health conditions, but it is true for everybody. So that's not a school of thought that I would sign up to for all of these reasons, and no doubt more. I'm not sure the President-elect's age has got much to do with this, to be perfectly honest. Take the opportunity today. I did so over social media at the weekend, but this is the first time I've had the opportunity to do so to camera, to warmly congratulate President-elect Biden and Vice President-elect Harris on their success. I think it is a significant moment for America, obviously, and a significant moment for the world, and I wish them well. I don't think there's any doubt that absolutely at the top of their priority list will be America's response to COVID. And, you know, I think if you look at cases and the trajectory of the virus across much of America right now, that renewed focus is really necessary. And as we know, America often has the potential to play a leadership role in the broader world. And I hope that the election heralds a new era of multilateral cooperation on the big challenges the globe faces, from COVID-19 through to climate change and a lot else beside. But I don't know that it's got anything to do with how old the new president is. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Just back on the vaccine, I was just wondering how this affects your thinking in terms of the level of restrictions that you set now. For example, if in a few months science could give us a way out of it, does that sort of increase the case for sort of harsher restrictions now, you know, knowing that potentially we're going to have a way out of this in a few months? And also, just on the same topic, I realise this is anecdotal, but I've spoken to a couple of people, you know, just friends really, who aren't sort of conspiracy theorists or anti-vax people, but they've said they'd be reluctant to take the vaccine just because they're suspicious, given the sort of length of time it's taken, the very quick length of time that it's been developed in. So I was wondering how big of an issue that might be, and whether there's any work going on to, you know, convince the public to take a vaccine once it becomes available. Thanks.
The reason there is, and Gregor might want to say a bit more about this, the reason there are robust regulatory processes around vaccines, the reason there are requirements around trials of vaccines are to make sure they're safe for the human population. And if we get vaccines, as hopefully we will in the not too distant future, that have got all of that certification, then I would certainly be encouraging strongly, and the Scottish Government will be encouraging people who are eligible. Obviously, we don't yet know exactly what groups will be eligible and in what order of priority, but I'd be encouraging people to take it up. You know, there has been a lot of work by some of the best brains on the planet to get to where we are right now. You know, we're not quite there yet, but the news is encouraging, and I think that's a thoroughly good thing. Our decision making is not, as you set out in the first part of your question, it's not, you know, it wouldn't be as crude or as simplistic as to say because we've got hope of a vaccine reasonably soon, because remember, we don't yet know exactly when we will be in a position to actually start vaccinating people, that we can just have harder restrictions now. It's not quite that crude. What I would say to people, though, is we're all weary with this. We're all really fatigued. We're all missing our families. We're all missing living normally. And that, I think, can lead people to think this is never going to be over. So, you know, I'm just going to go and see my family, or I'm just going to, you know, go and mix and socialise with people because I can't see the end. What I would say to people is, let's all just draw a bit of encouragement and motivation. If we stick with this now, there is just that glimmer of light at the end of the tunnel. But if we don't stick with it now, the journey from here to the end of the tunnel will be a lot more difficult, with a lot more loss of life and a lot more people falling ill and a lot more damage to the economy than it will be if we all stick with it. So let's just take some motivation from the fact that there is that bit of hope on the horizon to convince ourselves that if we stick with it now, then we'll get to the other side, hopefully, with less heartbreak and less damage and less loss of life along the way. Gregor, do you want to say any more about just the vaccine?
I do, because I think at this point in time, the first thing I want to do is pay tribute to the research teams who've been involved in really what is a remarkable journey to get these vaccines to the stage where we're now thinking about they could be successfully deployed in the not too distant future. I not only pay tribute to them, but pay tribute to the tens of thousands of volunteers who've taken part in the trials and making sure that they're not only effective, but that they're safe as well. And that's the key point here. No one should mistake that the rapid development and research in relation to these vaccines is cutting corners in any way, because these still go through extraordinarily rigorous research trials to prove both their effectiveness in the real world, but also their safety profile as well. And it's only at the point when that has been proven that our regulators, the MHRA, would agree to their deployment at full scale across the country. So there is a very robust, very safe and very proven process before these vaccines are made available. And certainly if I'm fortunate enough at some point to be in one of the eligible categories for it, I'll have no hesitation in making sure that I get my vaccine.
Ditto, although I'm not sure I will be, or Gregor will be, but absolutely no hesitation at all in taking a vaccine that will have gone through all the processes and can deliver, hopefully deliver the protection against getting this horrible disease. Scott McNabb from the Scotsman.
Thank you, First Minister. You did say earlier that cases, for all the progress that's been made, cases still remain too high for comfort in Scotland. Does that mean the prospect of a circuit breaker style national level 4 approach is still under consideration? And how soon before you would have to take that decision with the onset of winter? Thank you.
I am not anticipating a national level 4 approach when I announce these decisions tomorrow, and I say that with the obvious caveat that we've not taken these decisions. But just as I wouldn't anticipate any areas necessarily going down a level tomorrow, I am not anticipating a decision that would be a national level 4 application. Gregor may be about to say something different, but I suspect not. That doesn't mean that there isn't still under consideration the possibility of particular areas maybe having to go up a level. We haven't reached final decisions on that. But because I'm not anticipating that tomorrow, does it mean I can rule it out for 7 days' time or 14 days' time? No, I can't, and nor should I, if we're continuing to take a very evidence-based and cautious approach to suppressing this virus. But what I do know, and I think I can say this without any shadow of a doubt, and actually based on our experience in the last few weeks, that the best way all of us have of avoiding greater restrictions is to stick rigidly to the restrictions that are in place in any given area at any given time right now, because that is what has been making a difference. Yes, we have to assess whether it is making enough difference in every part of the country, but it has undoubtedly been making a difference, so we need to stick with it. Do you want to say anything about that? Okay. Rachel Watson from the Daily Mail.
Thank you, First Minister. Just back on the vaccine, obviously we don't know if it's been approved, it's not been approved yet, but if the vaccine is approved, where will that sit with your flu vaccine programme? Do you expect the flu vaccine programme to be finished by then? Does the NHS have the capacity to carry them both out at the same time, or would you have to pause the flu vaccination programme?
The flu vaccination programme, no. Obviously, I can't answer these questions in detail because we don't yet know when we'll be in a position to actually start administering COVID vaccine. But the flu vaccination programme is well underway and will be, even more through by December and into January. But getting vaccinated for flu remains really important, so there's no question of pausing or interrupting that. Do you want to say any more? No. And lastly, Tom Gordon from the Herald.
Thank you, First Minister. Just on travel restrictions, can you tell me, do they go hand in hand with level 4? So that if nowhere goes to level 4, we don't see the need for legally enforceable travel restrictions? And also to Jeane Freeman and the CMO. I think we can all anticipate that a vaccine would go to the old before the young and the sick before the fit and key workers before the rest. But can you just flesh out the picture a bit more? Surely at this point you can give us a bit more detail. And on Dan's point about take-up, is there a level of take-up you require to hit before we can do without any restrictions? Because unfortunately there are people who just won't accept this vaccine. And although it might be self-inflicted if they get it, they could still jam up the NHS. So what kind of take-up level do you need to do away with restrictions?
I'll hand over to the Health Secretary in a second, but by definition, I'm not sure we can answer these questions right now because we don't know precisely the nature of. So the one that's in the news today, 90% effective with, I think, a likely requirement for 2 doses about 3 weeks apart. But other vaccines that become available, because it is likely that we will require more than one in terms of the volumes that will be required, may have other characteristics that may say something different. So I'm not sure we can say exactly yet what levels of take-up we will require. We want is maximum take-up, or what groups of the population beyond some of the obvious sort of assumptions that we all make will be in that order of priority. But the Health Secretary might want to say a bit more. In answer to your first question, no, it is not the case that level 4 and travel restrictions go hand in hand. There are going to be a continuing need for travel restrictions as long as any part of the country is at level 3. And in future, if any part of the country goes to level 4. But the judgment about whether or not to take these from being restrictions in guidance and make them restrictions in law, whether it's at level 3 or level 4, will depend on judgments and assessments about whether the guidance is resulting in strong enough compliance with them, or whether we need to strengthen that through a legal underpinning. So it's not the case that it is simply an automatic relationship between that decision and decisions about level 4. Jeane, do you want to add anything?
The only thing I'd add is that the position of the Joint Committee on Vaccines and Immunisation is really important. We're not trying to avoid this at all. That's the group that advises us on the priority groups for the flu vaccine. And it does that every single year. And this year, as you know, that's a much extended programme. So that group will undoubtedly it's been looking at what it believes should be the clinical prioritisation for the delivery of the vaccine, who's first and then who's next and so on. And it has reached an interim view. It will be finalising that view in very short order. And when it does that, then we will know. That's important to us, not just for people in Scotland to know the prioritisation and the order. It's important to me to know that so that I can make sure our delivery plan is aligned properly with that. So we will know that in very short order. I think we can make reasonable assumptions, each of us, about what that might be, but I think the right thing to do is to wait for that clinical and professional advice, and then we all know what we're doing and we can get on and deliver the vaccine as soon as it is available to us.
And I'll hand over to Chief Medical Officer to say another word about the vaccine.
Paul, maybe it would help a little bit if I started to explain just the role of the JCVI, the Joint Committee for Vaccines and Immunisation as well. So this is not a new committee, is the first thing to say. This is a committee that has been in existence for many, many years and provides us every year continually updates on how we should be approaching the whole vaccine and immunisations programmes. Now, whether that be flu, whether that be childhood immunisations, it provides that advice. It's an independent group staffed by clinical experts in this field who are able to digest the latest information and be able to make recommendations on that basis. So though they've formed an interim view, what they will be waiting for just now is the trial data which Pfizer have announced today to get a better sense of how effective is this in different groups, and therefore how do we recommend prioritisation of these groups going forward. And that will include advice to us as to what the kind of targets might be around about particular uptake to achieve its effect as well. So all that process will now be underway once this data is available to them, and we would expect very quickly that what we will get from them is a formal final recommendation as to how to proceed with using this vaccine out there in the real world.
Thanks, Gregor. That concludes the questions today. Thanks to all the journalists for joining us today. Thanks to Jill for interpreting for us, and thanks to Jeane and Gregor for helping me answer the questions. Thanks to all of you for watching. I will join you tomorrow from a slightly later time and from the Scottish Parliament. You'll find out on the Scottish Parliament website, and I'll make sure we tweet information about exactly what time tomorrow's statement is, but I would guess sometime round about 2:20 or thereabouts, when we'll set out the outcome of the first review of the application of levels of intervention to different parts of the country, and we'll be taking account over the course of today and into tomorrow of all the factors that I've been talking about today. Let me just end with a point I made earlier on, that the restrictions that are in place right now and everybody's compliance with those restrictions is having an impact. It is not an exaggeration to say that what you've all been doing and all the sacrifices you've been making over the past few weeks will have saved lives and will continue to save lives. We've got difficult judgments to make about whether in different parts of the country the current levels of restrictions are sufficient, not just to plateau cases, but to get them going down again. And that's important for the reasons I've spoken about. But what we do know is all of us sticking to these restrictions is important and is making a difference. And today we do have that ray of hope, that speck of light on the horizon, that at some point in the not too distant future we may have scientific developments to help us out of this pretty dark tunnel as it has seemed in the last few months that we are in just now. So please stick with it because it is helping to save lives and protect the National Health Service. I'll see you from the Scottish Parliament tomorrow, back here on Wednesday at 12:15. In the meantime, thanks for joining us today.